Hi, everybody. Welcome to another episode of the Autistic Voice Project, where voice, as always, is an acronym that stands for Validating Our Identity, Culture, and Experiences. I'm Matt Lowry, a practitioner in Kentucky.
I'm Dr. Erin Finley, a psychologist in Napa, California.
And joining us today is...
I'm Dr. Stacey Greeter, a child and adult psychiatrist. I see patients in Florida, Colorado, and Washington State.
And we were talking about the difficulties in telling medical professionals that we are autistic when we are seeking care, as we all realize that we all have issues with dry eye that may be related to Sjogren's and mast cell activation syndrome, so we all had to lubricate our eyeballs. Because
Indeed.
this... And as I was hitting the record button, because I can only do one thing at a time.
Fun bonding, right?
I shall lubricate my eyeball on camera.
Lubricate.
Yeah.
Yep.
So, yeah, because again, our meat bodies don't behave as meat bodies should. So here we are.
Yeah.
So yeah, let's talk more about all of those things that we were talking about last time. For people who are binging, it was near instantaneous. People who had to wait a full week are on the edge of their seats to see how we come about this, how we have effective cross-neurotype communication, how we deal with the triple empathy problem, because there's more and more empathy added onto this problem as we go, and whether or not you announce that you're autistic to people that may not understand you at best or may hate and fear you at worst. Because one of the problems that as we are recording this, you might be listening to this in the future. If there is a future, congratulations, you made it. So we are dealing with MAHA, Make America Healthy Again, which means that there is a person who has no medical experience who appointed people who were convicted of quackery to be in charge of medical experiences and says, yes, everything is related to environmental toxins while deliberately increasing the number of environmental toxins. We live in a very weird area.
Yeah.
So where should we start? Because it seems like it's a whole basket of topics.
Why don't we start with when or if do you disclose that you're autistic to your medical providers?
What do you think, Stacey?
Oh man, it's tough. I think that, gosh, I kind of think it's hard. You don't know until you disclose, and then you see if it goes south or not.
You gather more data.
I'm sorry, right? I mean, because there's experiences.
What an autistic answer of you.
Right? I'm like, I don't know.
Right.
Yeah.
I mean,
give us a firm yes or no. Yes.
Yeah. I mean, I think definitely I've had it derail conversations, right?
Yeah.
Where you're like, yeah, I disclose this as a medical issue, and the person wants to like argue about whether or not you're autistic during the appointment instead of, hey, I'm here for, blood work, physical, etc. And I've had it be like, I think helpful from a rheumatological standpoint, because there's so much connection between the rheumatological issues and
what is a rheumatological thing?
Yeah, like just having really screwed up connective tissue, to be honest.
Yeah. For people who are not medical professionals, is rheumatological a kind of cake?
You're funny, Matt. Yeah.
She thinks I'm not dumb. Yay. Go on.
Yeah. Okay, so rheumatology is about your immune system, joints. Those are the doctors who are treating like arthritis, autoimmune disorders. For me, it's called mixed connective tissue disorder, which is medical code for we don't know, but your connective tissue sucks.
Yeah. And that's the thing, because when I do autism evaluations, I always ask, how bendy are you? Because, when I was a kid...
hypermobility spectrum.
I got accolades from my peers because I can turn my feet around 180 degrees, and I didn't think there was anything weird about that. I could dislocate my hips. I didn't think there was anything weird about that. I got all kinds of weird finger stuff. And now my eyeballs are falling out. Who knew?
I mean, how many times have you guys found it helpful to disclose to your medical professional that you're autistic versus unhelpful? Right?
It's been a mixed bag for
Most
me.
of the time, I wish I could say, like, yes, tell them you're autistic.
Yeah.
Be autistic and proud. I mean, you should do that, right?
Yeah.
But
Right.
is it helpful?
I've had I wouldn't say that I've found it particularly helpful most of the time. I had one medical provider who was beautiful about it. She was just super responsive, and like she already had some ideas about neurodiversity and had already done some training, and I was like, oh my god, holy shit. And so of course she moved away. As they do. My regular physician, who is a good guy, I told him after knowing him for about 5 years, and he just kind of looked at me and just sort of took it in. Didn't really comment about it either way, and then we went on with the conversation. So I'm not sure where it went inside his head, but it didn't really affect what we were doing positively or negatively. I have had people who are like, well, but why do you think you're autistic? I mean, I do that too, and I did not go into the, well, you might think about some things then, my dear.
Why do you think you're not autistic?
Right? Yeah. And I have another colleague or another professional who I respect very much, who is very focused on seeing my ADHD and not so focused on seeing my autism. And I just leave that alone mostly. So it's a mixed bag. I would say that the guideline that I use is I need to get to know the person a little bit. I need to feel like I have some kind of a connection with them, some kind of a rapport with them. I need to be working with them long enough to feel like I can trust them. I also, again, I have some privilege in this area because of being able to have access to a lot of really good doctors within a reasonably short driving distance.
Yeah.
I also have gotten to the point where my first appointment with any doctor is, hey, I'm a psychologist, and so while I'm not a medical professional, I do understand how to think about diagnostics. And so I would really like to be working with you in more of a collaborative spirit. Is that something that you're comfortable with? And if that person says no, then I might find somebody else.
No,
but
I am the god here. You shall listen to me.
Look, I had one of those and I fired his ass.
Good.
And you know, it was like I had questions and I wanted to know, you know, it was right when I got diagnosed with Hashimoto's thyroiditis,
Another common thing.
Which is very common. It's an autoimmune thyroid condition for anybody who's not a medical professional. And this doctor that I was working with was highly respected. But I had questions and I was, you know, learning about functional medicine at the time, just not from a provider standpoint, but from a educated consumer standpoint. And I had questions for this doctor. And I said, well, why don't we run these tests or those tests? And instead of him having a dialogue with me, he yelled at me.
Aww.
And
He yelled at
was
you.
like, he yelled at me and he was
Oh,
like,
my.
well, I'm the doctor here and I went to med school, blah, blah, blah. And I was like, okay, fine.
In the
And I
psychology
walked
field,
out and
we
I
call
got
that
it.
defensive.
Yeah. And I walked out and I found a new provider because I will not.
And I mean, it's
yeah.
hard. A lot of people have medical trauma from medical invalidation.
Oh, yeah.
Yes.
And then that creates medical avoidance. They don't want to go back to the doctor. What do you know? And
right.
I work so hard with people getting them it's so vulnerable and hard being a patient. I tell my patients this all the time, right? Like, I would rather do 10 hours straight of psychiatry as the psychiatrist than sit in another doctor's office for 30 minutes. Hands down, any day.
Yeah.
Okay?
Oh yeah.
Right?
Totally.
Like, the job of being a patient is hard.
It is
very
And
hard.
vulnerable.
I avoid the doctor myself because every time I go in, they say, I see your diagnosis is fat. And that's just where they leave it.
Oh yeah,
Because-
I've been there too. Mm-hmm.
Yeah.
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 No.
It's
it's
as
really
far
tough
as self-disclosure goes, I'm from Kentucky, and
Yeah.
I might as well just self-disclose at Wendy's. So it just nothing, and it is incredibly hard, especially as autistic people with lived experience of all these, and to say, yes, I've done the research. I'm in many groups. I know many people who have these comorbid health issues, and I've been researching on how to treat all these. I really need this specific medication in order to do this because according to study after study after study, which I've been extensively researching for the past 3 years, it seems like this is the right way to go, but I need a medical professional to do it. And they say, oh,
Right.
you're med seeking.
Right.
Yeah.
Yeah, it can be really, really hard. And I think hard and painful because you're so vulnerable and you're so powerless a lot of the times as a patient. And I think also I'll say even when doctors are really collaborative and mean well, the communication is tough. You know, like I mean, okay, just being a doctor, I don't understand a lot of the stuff that my doctors are saying and instructions at times. Like I got a PRP, platelet-rich plasma injection in my terrible hip. Okay. And I was asking the orthopedic surgeon, okay, so what are my activity restrictions? When can I go back to weightlifting?
Good questions.
When can I go back to the elliptical? And he's like, well, you're probably not, you're going to be sore, so you're probably not going to want to for a few weeks. And I was like, does that mean you're not going to want to? Like, I'm sore and it will be painful. So, like, I would be distressed, but it is okay to do if I'm okay with pain. Or is it like going to mess up the PRP injection if I do it? Is it like a bad idea medically? Right. And so, you know, you have to ask like 5 different follow-up questions to figure out the actual, like, what
because
you're
again,
supposed to do.
Well, we tend to have what they call pedantic speech, where we use very precise language and words mean words. Whereas a lot of people say, yeah, it's Tuesday. And you're like, the hell does that mean?
Right.
What? Well, you know, Tuesday.
I
and
had
like,
to dig
what?
it down.
After Monday,
yeah, I was
pretty
like,
consistently.
if it was you and you just had your PRP injection, I was like, if I want the PRP injection to work, but I also want to exercise. So how long must I not exercise for the PRP injection to work?
You want the graph overlay of maximum efficacy and time to find the ideal intersection of this is the answer. Because
and
you want
that's
data.
where I might use an analogy.
Yeah.
I might use an analogy like, you know, after I had surgery, I had to wait 12 weeks, you know, I had to wait 2 weeks to do this, you know, lift more than 10 pounds. I had to wait 12 weeks in order to resume full activities. Can you give me any guidelines like that? You know,
I have a book
to give a more specific.
I have a book that is slightly out of reach over there that was one of Mark Twain's favorite books. I recommend everybody go get a copy. It is called English as She Is Spoke. And it is translated, it's an English guidebook for Spanish people written by the Portuguese. And when you try to converse across these 3 different languages, there's a lot of weird shit that happens. And it is hilarious. Mark Twain said that it was the funniest book ever written. And at the time, it was not published comedically, it was published as a real thing, right? And this is the thing about the triple empathy problem. And this is the thing about translating autistic into holistic, translating holistic into medical, translating from medical to holistic to autistic. And there's so much effort that goes in, for us at least, to try to manage and navigate that system instead of, on the part of the healthcare provider. What's up with that? How do you deal with that? How do you deal with the extensive, what does that mean precisely? Can we dial that into a more exacting word?
Yeah. I sometimes ask, I was like, okay, what would your next steps be if it were you in terms of when you would do XYZ?
No, that's great. That's great.
That's how we finally got there, where I was like, wait a minute, you don't want to exercise yet? I want to. Can I? Will I injure myself? What can I do? For how long? At what time?
Well, and that's the other thing is like, this is the classic double empathy problem, right? Because you're asking the literal words that you mean to ask and the literal words that you want answered. And
how dare you use language to words to say the words that you want to word? Oh my.
Right? And yet, using the more euphemistic way that holistics tend to word, right? Well, you probably aren't going to want to for, a couple weeks. Right, like that there may be a hidden message in there that's like, okay, you really shouldn't for 2 weeks.
Right.
Yeah.
When you're actually just really wanting if I shouldn't for 2 weeks, just tell me I shouldn't for 2 weeks. I'm fine with that.
Yeah.
And then
I just
I'm like,
want to know.
I want to do it now, sir.
Yeah.
I want to do it now.
Right? I will go to the gym now. I was like, is stretching okay? And then the answer is, well, we don't have a lot of info on that, Yeah. Okay.
Mm-hmm.
So should I stretch today? Should I not stretch today? Should I stretch next week? Should
and at least the doctors who are like, as long as it doesn't hurt you, it's fine.
Oh,
like,
no,
okay,
that's terrible advice. Nope, never.
Right, yeah.
No.
I can work with that, but maybe for somebody else, that's not okay.
Especially with interoception difficulties and not
true.
knowing how far because we're like, that's fine. I'll just go ahead and walk on it. Snap.
Exactly.
And,
I mean, if he's like, oh, yeah, well, you're sore. I'm like, well, but actually I'm really, really good at doing activities despite pain because I live in chronic pain. So
that's true.
Like when you're a chronic pain person, that just doesn't help you figure out what you can and cannot do.
Tell us more about that because this is
that's a good point.
Oftentimes doctors will say, on a scale from 1 to 10, how much does it hurt? And I would be like, well, this is a kidney stone and I sort of want to die, but I've had worse. And what's up with?
Or I can imagine worse.
Yes, yeah. Like, well, it wouldn't be as bad as if my arm was being gnawed off by a wolf. So
I know because, I went to the ER. I had a spinal leak after a lumbar puncture, where they put a needle in your spine. Right, and they're
my gosh,
it can't be a spinal leak unless it is definitely the worst headache of your life. And I was like, no, that would be when I had meningitis.
Right.
That would be the worst headache of my life. Right. True facts. Because with the wonky immune system, we get weird stuff.
Yeah.
So, yeah, these superlatives. I know that's a tricky one because you're like, well, if I give a number like 3 or 4, are you supposed to, are you obligated to give a number above 5? On the pain scale, or I don't know.
I like the pain scales that actually have words. I've seen a couple different ones, and if I think about it, I'll try to maybe link them in the show notes. But I really like the ones that are like, I can mostly ignore it, but I know it's there, right? Or I can't do anything that I need to do except for the bare minimum, or I'm lying on my bed screaming in pain, or I'm passed out because my pain is so bad.
Yeah.
Right? Like those things
But-
I can compare myself to.
But also, like, when they ask you, how's your pain? Which body part?
Right.
Right.
Like, many body parts hurt, you know?
When was the last time you
Is it-
felt good? I think I was 5.
And this, again, this is a thing that leads us to need providers who are better educated and understand this, because otherwise we are labeled difficult, especially
Right.
if you're a woman, because God forbid you have the feelings and the feels there. Because again, you know, I was telling the when we were doing the class with Kate McNulty at the Chicago School, I was talking about how, you know, when we're telling allistic professionals about our hypersensitivity, about our pain for sensory intensity, about all of these various things, they have absolutely no frame of reference, because it's like going to a cisgender male gynecologist and they say, yeah, I hear her periods are pretty rough, take an Advil about it, instead of understanding, oh, it could rip your guts out. Oh my, that sounds very painful. So how can you effectively describe these sensations of chronic pain in multiple body parts all the time, forever, always, to somebody who has zero frame of reference about that?
I don't know. I don't think it's possible, honestly. I think, yeah, I mean, I'll tell you guys, until I was diagnosed myself with fibromyalgia, I had no concept of what that would be like. And I admit I had stigma as a doctor way back in the day for fibromyalgia patients. And then I became a fibromyalgia patient. What do you know, right?
Mm-hmm.
I was like, what do you mean all over body pain, right? You know, that you have no idea what's causing it and we can't find anything that it's linked to. And now I know exactly what that is like, experiencing it myself. I don't know if it's possible for people to really understand. But I think, fortunately, I work on myself. I have a good therapist, and I've grown in my capacity to really embrace experiences that are not my own.
Yeah.
Yeah.
When I worked in community mental health, I did autism evaluations, but again, it was mainly community mental health therapy. I had a coworker, and coworker had a kid clearly autistic. Coworker didn't know it. Coworker was autistic. She didn't know it. And she diagnosed with fibromyalgia, and, you know, it's like, yeah, it really hurts. Our supervisor would, whenever the coworker was out of the room, referred to her as fakey, because she, you know it can hurt all the time for no reason. She's just faking it. She just really likes attention. Boy, is she needy. And my coworker was under the impression that this woman was her friend. And
that's gross.
Because I'm autistic and I can't read a room, I created an interoffice incident by saying, you know, she's not really your friend because she says these things about you. I thought you should know, because I find that uncomfortable. And then, of course, I come in and everybody's scowling at me. And I'm like, hi, I don't understand.
You broke the illusion, Matt.
Yeah.
Right?
It was a whole thing. But that's the thing, because people don't understand this. And when they don't understand it, it's imaginary. It's a snuffleupagus all of a sudden. Why are you diagnosed with snuffleupagus?
Yeah, like, just because a doctor doesn't know why or what's wrong does not in any way diminish the reality of your suffering.
Yeah.
Right. If you're suffering, you're suffering, and that matters.
And it doesn't matter if other people can see the suffering. It doesn't matter if other people can understand the suffering. If you are suffering, that is valid.
Yeah.
And medical
That is reality.
gaslighting is starting to get more and more research focus, especially for those of us with chronic health conditions, because it is a real thing, right? People come in, they like with fibro or endometriosis is another one where we can just experience excruciating pain, and the doctor, like, I had endometriosis and adenomyosis, the doctors that I worked with were like, well, let's just get you pregnant and that'll get rid of it. First of all, that's
They
not
prescribed
medically.
pregnancy?
Well,
What?
I was trying to get pregnant at the
Oh,
time,
okay.
so it
Yeah, I was
wasn't like they were just prescribing it out of nowhere.
Yeah.
But it's not medically accurate, right?
No.
Endometriosis is cells that are similar to the lining of the uterus in not uterus places. Right? Adenomyosis is when the actual lining of the uterus goes into the muscle of the uterus.
Oh, God.
Both of them are excruciating, right? And so, like, this idea of like, well, let's just get you pregnant, it'll be fine.
Yeah, a person who has never experienced uterine pain said, let's do a pregnancy about that.
Yeah.
Right.
I threw a study in the chat too. Medical
Oh,
invalidation in the clinical encounter, a qualitative study of the healthcare experiences of young women and non-binary people living with chronic illness.
And that's a whole other overlap with non-binary people and trans people, because
Yes,
it seems like doctors have absolutely no idea what to do with anything other than cishet men. Because,
well,
yeah. Tell us all about that, because I never went to the medical school, so I only hear legends about it. But, Stacey, your eyes rolled so far back in your head, you could see your brain. So tell us about this.
And you know what? Okay. And I also want to make sure I'm not in a place of doctor hating, right? Like we have righteous anger that is valid, right?
Mm-hmm.
And also there are many, many awesome doctors working their buns off, like, to really do right by their patients.
We can clarify that we
Both
like
are
the
true.
people, but dislike the system.
Yes. Yes.
Yes.
That is really screwed up. And I think studies do show, okay, like the one I threw in the chat, that being part of a minority identity, being female, being young, interestingly, and appearing healthy on the surface, being a young person, right, leads to more medical invalidation, because they're like, we're looking at a healthy young person, right?
Right.
Yeah.
So
you're too young to feel that old.
Well, one of the things that I've heard, and I don't have a study to cite, so this may be apocryphal or it may just be my brain making things up. But one of the things that I've heard
We're
is
going
that
prophecy territory. That's awesome. Go on.
right, is that medical research until, I don't know, sometime in the last 50 years, let's say, really focused on men because they were trying to eliminate variables. And basically they thought of women as the same as men, but with like pesky, complicated, weird hormone things. And so if you figure it out about men, you should be able to just apply it to women. Except it turns out that those weird, pesky, complicated hormone-related things, among other things, are related to how, people with with uteruses and ovaries function.
I must say, I drink lots and lots of coffee, and I have never had endometriosis, so I attribute that.
Right. It must be the coffee. It must be the coffee.
Yes. Correlation is definitely causation there.
Yeah, exactly.
Yes.
Yeah.
Also, ice cream causes shark attacks.
Yes, exactly. Yeah.
Hashtag sarcasm for anyone who does not get that. Ice cream does not actually cause shark attacks, but they are highly correlated because they
sell ice
seasonal.
cream at the beach where sharks live.
Also true.
And
Yeah.
And also, if you ever try to milk a shark, you're going to get attacked. So
I have honestly never thought about trying to milk a shark.
yeah.
But I
Mostly
think
because it's not a mammal.
There's going to be so many Googling now because, hashtag shark boobs, hashtag shark milk. So,
Mommy shark.
I'm bringing us back to saving the world here. And so we
God.
need, so saving the world, we need more people from these non-represented identities to become medical professionals, right?
Ooh.
We need non-binary medical professionals. We need autistic medical professionals, right? We need more medical professionals in ethnic minorities.
All the things.
Yeah. I think that would help a lot.
Yeah.
A variety of perspectives. Dare I say a diverse range of perspectives.
And an equitable scenario for research.
Yeah, because
perhaps even inclusive.
The more perspectives we include, the better off humanity is because we know more. Learning is always a good thing. More data. Anytime somebody wants to restrict what you can learn, that's bad. We need to learn as much as humanly possible. But again, we are bottom-up processors. We love data. We want to know all of the complexities and all of the interplay and all of how one variable impacts another variable, and makes for a complex system.
And interact in an egalitarian, collaborative, direct way.
This is the world that we absolutely need. And this is why we absolutely require advocacy, even though it is exhausting. And
right now in this world, in the United States, terrifying.
Yeah. As we record this, it is not yet September. September is but days away when RFK will announce that the cause of autism is probably going to be vaccines because he hates vaccines. But who knows? He could throw
Didn't see it coming.
Yeah. He might throw a dart at a board and all of a sudden it's schnauzers. Who knows?
Yeah.
So
I don't know about you all, but my vaccinations have not leveled up my autism, which I am very upset about, actually.
Yeah. I hit Super Saiyan autism, but far before the vaccine.
Yeah.
Yeah. And so I think, I've been studying this. I think now more than ever, I'm like, how do we reach people and do effective advocacy and science communication in this world where misinformation is possibly going to end us as a species at some point?
Well, not just misinformation, but disinformation.
Yeah.
Okay.
Back in the day, we called them lies. I like lies.
Well, yeah, I mean, but disinformation definitely falls under the umbrella of lies. Like, so for anyone who's not
I don't know
clear, I'm going to get pedantic for a second.
Okay, cool.
Right? Misinformation, you're just mistaken. Like you say, you know what, the sky is blue because of the oxygen saturation, and you really think that's true, and then you find out later it's not. You gave out misinformation. By the way, I have no idea why the sky is blue. Please don't believe me. What I just gave you is misinformation because I don't actually have no idea.
Shark boobs.
Exactly, shark boobs. Lies are untruths, and there can be lies of omission where you leave part of the truth out. That's the best type of lie for me because I'm not good at the other kind, which is a lie of commission where a person is actually putting something out proactively into the world that is untrue. Underneath that umbrella, underneath the lies umbrella, is disinformation, which is a strategic plan of information, of lies going out into the world for a malicious purpose.
And profit.
And, well, yeah, usually the malicious purpose includes profiting somebody in power.
Yeah, and that is unfortunate that we live in such a world because we've had a slow creep towards this over the past several years. And we absolutely need, especially since autistics tend to gravitate towards occupations such as archivist, museum operator, librarian. We are the people who love to gather the information and to save the books and save the data and do the research.
Categorize it.
We love categorizing.
And be the whistleblower that this is not right.
The truth tellers.
Justice sensitivity, yes. Kinsey, Alfred Kinsey, was clearly autistic. He talked about the love of organizing data, the love of organizing his collection, and the love of doing research for the sake of doing research. And of course, the people of his time drove him into poverty and death because they're like, we don't want information. Stop doing that. And it was incredibly tragic. And this is why it is up to us to continue doing the research in times of uncertainty, so that when the climate is better, we will have information to come back to. But on that, you've got a link there.
I threw in my brain diverged back. I wanted to make sure you had the barriers to healthcare, triple empathy problem may lead to adverse outcomes for autistic adults, a qualitative study.
Excellent. You've gotten some good data here, and
I can
our
keep
audience,
it coming. I can just throw all of this in the chat.
if our audience loves one thing, it's lots and lots and lots of data. So
yes,
you came to the right place. But with that, we are at about that time, so we will call it another day here at the Autistic Voice Project. I hope you'll come back another time, non-consecutive.
Love to, Matt, please.
And
yes.
we would love to have you here and come back, and especially when you want to promote more presentations and tell us more about everything.
I almost forgot to mention. I was supposed to mention this. We have created. Okay, so I was frustrated and wanted a deeper dive and more autistic-led information about autism. So Okay, so I actually accidentally started this process of creating a conference with my dear colleagues.
As one does, yes.
Yes.
I accidentally started a conference. I love it.
I did. There's a story behind that. I'll have to tell it next time. Okay, it involves RSD.
Okay.
But we have this grassroots conference happening called Autistic Clinical Insights that is led by a bunch of extremely passionate autistic volunteers who are mental health professionals to give lived experience and also depth of information about autism. Instead of like your typical academic conference may have like one or two general presentations about autism. And then also from a lived experience neurodiversity affirming perspective. So please check us out.
And you have a link to these
Clinical
things.
Insights. Oh yes, I should do that too, right?
Because at that point, our audience is salivating and waiting for the link because, again, it's in the future and they think it's real time. They don't understand that it's already
It's in
there.
November.
So
it's in November.
Good.
By the way.
This will air before November, hopefully. So yes, I'm sure
And,
that they will be happy to join you.
And I'm also doing a fluffy monster themed presentation on how we can most effectively advocate for more neurodiversity affirming medical system. Like how do we do that as advocates with lots of fluffy monsters.
Nice.
I love that we started off all this with, yes, I'm very broken down and I can't do anything,
Yes.
but also I'm doing all of the things.
I know.
So yeah,
Indeed.
this is the dichotomy, and this is the way.
Yeah.
So yeah. But it's been great to talk with you. We will see you in Autistic Connections, our group, and we
Thanks,
will have
Matt.
you back on the
Thanks,
podcast.
Erin.
Yeah,
Thank
you're
you much,
welcome. I'm
guys.
so glad to have you here.
Thanks.
Have a good one.
Bye.
Bye.